WhatsApp now to the displayed number for complete study material and other queries. A nurse Wayne is aware that a positive Chvostek's sign indicate A. Hypocalcemia, B. Hyponatremia, C. Hypokalemia, D. Hypermagnesemia. A 29-year-old man is in the surgical ward on his first post-operative thyroidectomy. He appears drowsy but he is able to respiration by nodding head. He is developing mild restlessness. What is the initial recommended goal of care? A. Monitor vital signs of thyroid storm. B. Assess for bilateral vocal fold mobility. C. Monitor for swelling on the neck. D. Monitor for vocal cord paralysis. A nuclear plant experienced a leakage, and all involved workers were brought to the emergency department for treatment. The medical team prescribed potassium iodide for the workers to block radioactive iodine to be absorbed by an organ in the body. Which of the following organs is the most sensitive to radioactive iodine? A. Brain, B. Lungs, C. Kidney. The nurse care for a 60-year-old woman who history hypertension, hypothyroidism and elevated cholesterol levels. She takes tablets daily for each of the health problem. The doctor orders a routine dual X-ray absorptiometry test that shows the crease bone density. Which medication most likely contributed the test? Result: A. Statins, B. Antihypertensive, C. Synthetic thyroid hormones, D. Cholesterol absorption inhibitors. A 36-year-old man has undergone a subtotal thyroidectomy ago. He is suspected to develop tetany after the surgery. Which of the following symptoms best indicates tetanus? A. Tingling in the fingers, B. Pain in hands and feet, C. Tension on the suture lines, D. Bleeding on the back of the dressing. 5-year-old child is postoperative after tonsillectomy. The nurse should ask the parents to give the child which of food after discharge from the hospital? A. Meat and rice. B. Hot dog and potato chips. C. Mashed potatoes and soup. D. Cucumbers and tomato salad. The nurse is receiving a child postoperative tonsillectomy. Which of the following nursing assessment is suitable for the post-op care? A. Encourage the child to cough spontaneously. B. Observe for subtle signs of hemorrhage. C. Place the child in the prone position. D. Suction the mouth to clear the airway because of violent behavior. A client presents with hypocalcemia, hypophosphatemia, muscle cramps, and positive Trousseau's sign. What diagnosis does this support? A. Diabetes insipidus. B. Kuhn's syndrome. C. Hypoparathyroidism. D. Acromegaly. The nurse cares for a client who has undergone a tonsillectomy. The nurse is most concerned about which post-operative finding? A. Lack of appetite. B. Throat pain. C. Frequent swallowing. D. Nausea. "18-year-old man college student was rushed fainted at the school. He complained of severe quadrant. Upon palpation, he jerks even with sample was obtained. What is the most likely diagnosis of this patient? A. Appendicitis. B. Liver cirrhosis. C. Kidney stones. D. Duodenal ulcer. WhatsApp now to the displayed number for complete study material and other queries.